As cruise lines look forward to sailing again, they realize that health and safety is top of mind for both guests and crew. The first week in July, Norwegian Cruise Line was among the first of the large cruise lines to put out details of their new health and safety plan. From air filters to sanitation procedures and even things that are going to be different ashore, we're going to go over the details. I'm Bill from CruiseHabit.com, and we're going to talk about Norwegian's peace of mind. Before we dive into the details, please remember to like this video and subscribe to our YouTube channel and stay up to date with the rapidly changing world of cruising. On to enhanced screening protocols, one of the first points that NCL mentions. Now, all guests and crew will undergo screening. This is to be expected, and this type of thing has gone on for a while, but it's going to change. This will happen not only at embarkation, but when reboarding at each port, when entering dining areas, and even large public spaces. Screening will involve simple questions as well as touchless temperature checks. Crew, staff, and officers will be tested for COVID-19 throughout their contracts. Now, temperature screening is a late sign for COVID-19, but it's better than not doing it. And as things like rapid antigen testing become available and more reliable, it's very likely we'll see these procedures evolve. For guests, these screenings will mean that there are some queuing for various events or services that we're not used to. Lining up for dining, for example. But other measures will help with this. In fact, that brings us to our next point: responsible social distancing. Now, when the cruise line talked about this, everyone knew that this would likely mean reduced capacity on ships for some time. And that's true. That is one of the things they mentioned. Some venues will also have reduced capacity because, of course, even if only, I'm saying using this number arbitrarily, 70% of the ship is full, if all 70% of those people try and go to the dining room at the same time, you're not really helping. Online check-in and staggered embarkation will also be involved here. And that's going to vary by port, but should help reduce crowding on embarkation day, both on the ship as well as at the terminal. Generally, all the onboard activities, NCL says, will be available. That won't change. However, some might be modified. Now, what does this mean for guests? For one, there's no more showing up at embarkation time. Most cruise lines tell you, they give you a window when to arrive for your cruise. And except for Carnival, most cruise lines don't really enforce this, or at least didn't. And we're probably going to see that change, at least for a time. This will help with reducing the number of people in the terminal and queued up to check in all at the same time. We'll see how cruise lines handle this, NCL and others, because there are going to be guests showing up out of schedule, not just because they're trying to show up earlier, but depending on how you're getting to the terminal. Did you just fly in that morning? Did you have to check out of a hotel? You might just show up when you can. So you're going to want to consider these things when scheduling flights, transportation, and even hotel checkout times. See if later checkout is available. I wouldn't recommend scheduling a flight that arrives later because you should always fly in the day before if you're not local to the port. But just think about that as you're planning. Now, there could be less flexibility in dining times and other scheduled events, and it wouldn't surprise us if we saw some of the changes that NCL mentions to events that will still exist, being that, well, instead of doing this once during the day or once per cruise, maybe they'll do it several times and break things out. And I think most of us would enjoy less crowding in general on certain ships. Hopefully all of these things and any inconvenience that comes of them are reduced by the fact that overall, again, there will be fewer people, at least for a time, on NCL's ships. The next point they mention is air filtration. Ships, like all large buildings, for example, they have air filtration in their HVAC systems, but what NCL has done is they're installing across the entire fleet medical-grade H13 HEPA filters. These remove 99.5% of particulate matter in the air, down to 0.1 micron. That's 1/10 of micron. Now, to give you an idea, the COVID-19 virus is 0.125 microns, so it's 25% larger than what this filter blocks. I think human hair is hundreds of times larger. So that's some significant filtration, what we're used to seeing in hospitals. This type of thing should be really transparent to guests, so that's nice, because some of these things, of course, will impact the guest experience, even if not in a negative way necessarily, but this is something you're not even going to notice. It doesn't mean that there are going to be large, noisy air filters in every room and corridor or anything like that. There will be other increased sanitation measures. Embarkation terminals will now be continuously disinfected. And I think this is a good thing, because while I don't recall ever running into an embarkation terminal for any cruise line at any port that was dirty, you certainly see cruise ships being cleaned all the time, but I don't notice that at terminals, and that's something that's going to be changed. In addition, where possible, NCL says they will actually fog these terminals between ship embarkations. Other areas on the ship, like staterooms, public areas, especially high-touch surfaces, will be disinfected even more regularly than before. And if you've been on a cruise, you've probably seen these surfaces being wiped down constantly under normal circumstances. And what you may not have seen, unless you're a night owl like myself, is that a lot of the time, like 3 in the morning, they're out there fogging hallways and doing other stuff already. So that's going to be done even more. And that increased sanitation includes the use of electrostatic spray technology. Hypochlorous acid will be used to fog staterooms in public areas. This is a non-toxic oxidant that kills bacteria, spores, and viruses. It's safe to use, but even more effective than many commercial and hospital-grade disinfectants that you might see at home or in healthcare facilities. Other measures include full-service buffets becoming the standard, at least for some time. I've seen a lot of people on message boards kind of becoming concerned. They really like buffets and they don't think it's possible. Well, listen, the cruise industry has been doing different types of buffets for a long time. And so what NCL is saying they're going to do is that buffet and beverage stations will be full service with staff there available and helping to serve you. So think about if you've ever been to like a cafeteria, for example, where things are already plated and they hand you the plate, or perhaps they pass your plate down the line on their side, putting food items on your plate or plates, and then at the end you get it back. Something like that. This has been done on lines like Holland America, Oceania, and other especially premium lines where there's more staff available to help for some time. And listen, I think it's great for sanitary reasons and just I don't have to carry my plate around and worry about spilling things because I'm kind of a klutz. So that's great, and we can expect to see that. The increased staffing that will require, remember, we're going to see fewer people on their ships in general for some time, so that should help offset things. Now, personal hygiene is also a factor. So guests are going to continue to be encouraged to wash their hands, and I think we'll probably see more greater motivation coming from cruise lines. Already we've seen staff that remind people to wash their hands constantly when walking into buffet venues, but we may see this other times as well, more frequently. Maybe even with some enforcement, we'll see. Hand sanitizer will be prominently placed and available throughout the ship. This is something we've already seen, and in fact, out of all the cruise lines I've been on, I think we're a dozen or more now, NCL might be the best that I've experienced in terms of hand sanitizer placement, just having it everywhere, and we're only going to see more of that, so that's a good thing. Now, if you aren't feeling well, maybe because of some sort of infection or virus, or maybe for any reason, right? Maybe you trip and fall or feeling a little green from the motion of the ocean. Onboard medical facilities have been there for a while, but NCL says that they're going to really beef up these facilities. Part of that is going to involve increasing the inventory of things like medical oxygen systems, medication to treat COVID-19 and other respiratory ailments, the addition of on-site rapid diagnostic testing for COVID-19, that's going to be big. We're going to see things like this, both benefiting from the massive amount of research that's being done already for the treatment and diagnosis of COVID-19, but I think we could see it playing the other way too, where perhaps even some new techniques come about from the cruise industry needing to figure out the best way to do this. Now, in the event that there's some type of infection that's spreading on board, or before it spreads, hopefully, isolation facilities will also be available. NCL didn't say exactly how this is going to work. I suspect that because there will be more guest staterooms available, since ships won't be filled to capacity, some of those will be blocked off, even perhaps some of those that share HVAC systems, ventilation systems, and are adjacent to each other. Again, that part's speculative on my part, being blocked off so that there are areas that crew can be isolated from other crew members, guests can be isolated from other guests if need be, while undergoing treatment and observation from the onboard medical staff. In addition to the medical staff, though, the crew will be continuously getting in training in enhanced health and safety. That's something that I think if you look back to one of our other videos, or maybe it was an article over on CruiseHabit.com, we talked about things that might change in the cruise industry, some short-term, some long-term. And one thing I said is there are a lot of crew members that might be able to help with certain medical health and safety needs, especially like security, that could be cross-trained. So this might be something that they're talking about here. In addition, and this is really huge, I think this could end up being somewhat trend-setting for the entire industry. NCL says that every ship will now have a public health officer. It's a brand new position. It's never existed before in the cruise industry. And that person is going to be responsible for all of the sanitation and outbreak prevention initiatives on the entire ship. They'll also monitor the day-to-day cleanliness and CDC compliance. Talking about the vessel sanitation program that's been in existence for a while and has greatly helped reduce other illnesses on board. But in general, if it's about keeping things clean and safe, that's that person's responsibility. That way you don't have medical staff policing themselves or cleaning staff policing themselves. Not that people aren't trustworthy. It's always good though to have somebody else, double checking your work and making sure, somebody whose job it is to make sure that these things are all done properly. And that's going to be really big. And I think will resonate well with guests too. Now, in addition to all of this, it's important to think about how you're booking because things change, and NCL knows this. So they've talked about in the same release with the information about cruise changes, booking flexibility. Now with this plan, they're reminding guests that for cruises booked through November 30th of 2020, you can cancel up to 48 hours in advance and get 100% future cruise credit. That means if 3 days before you're sailing, you decide you don't want to sail, you're not able to sail, you can cancel, and you can get 100% future cruise credit that can be used up to December of 2022. So running shy on vacation time, not going to be able to cruise or vacation again in another few months, it's okay, there's plenty of time. For cruises December 1st and beyond, NCL's normal cancellation policy applies, which means that you can cancel up to 4 months before the sail date and get a full refund. Of course, some of these policies vary depending on where in the world you are, how you booked, and other things. So it's good to check that on the NCL's website or talk to your travel agent. NCL and other cruise lines have been scrambling to change all sorts of policies around cancellation and deposits and rescheduling of cruises in order to make it so that people are confident that they can today book a cruise, and if everything works out in a week, in 2 months, whatever, they can go. And if something changes, that's okay too. So we'd expect these policies to continue changing and evolving as cruise lines assess how changes are going to come about in the industry, as passengers test how they are when they go back to cruising. I'm not suggesting, though, that in the next several months you're going to see cruise lines, wipe out any cancellation penalties and go to something like we have now up to November 30th. But these are things that I do think are likely to change. None of this, however, is a replacement for travel insurance. A lot of folks think about travel insurance only when it comes to canceling their cruise, and there's so much more to it than that. Remember that travel insurance, depending on your policy, could cover you for medical evacuation, repatriation, the cost of medical care either on the ship or abroad, and many other things. In fact, we have an entire article over on CruiseHabit.com just about travel insurance and how to make sure you're picking the right travel insurance policy for you, because a lot of folks make assumptions around what is or is not covered. Some of the new measures extend to the shore as well, with Norwegian Cruise Line working with a number of their shore operators, tour guides, things of that nature, to make sure that the guidelines followed on board are also followed on your shore excursions and while being processed on arrival and getting back to the ship in various ports of call. Of course, not all destinations can be accommodated, and because of the dynamic nature of the situation, there may be times that itineraries are changed. Now, these are just some of the things that NCL has announced. It's as new treatments are developed for COVID-19, as new testing and diagnostic methods are developed, things will absolutely change. Beyond that, the adjustments are almost certain just based on how things go once sailing starts, right? A lot of cruise lines have said they're going to start sailing in August. as of right now, that's their plan. No one can commit because we just can't tell the future. But sometime in the next several months, we're likely to see cruising start at a decent clip. And as soon as that happens, we're going to learn what works, what doesn't, what's effective, and what's not. So, you know, the best planned moves today, we'll have to see how those work for the cruises of tomorrow. And everyone will have to stay, especially at the beginning, just a little bit flexible. Now, some of the measures that we talked about, that NCL mentioned, like reducing passenger load, are temporary. I can pretty well assure you that if you go on NCL Escape in 5 years, barring any other issue, any other circumstance that comes up, you're not going to see reduced capacities like they're talking about in the coming months. Other things, however, are probably here to stay. We're probably going to see all the more technology and repetition in terms of disinfecting procedures. We may, on some ships, permanently see changes in the way that buffets work. There will be some things that will stick around, and to me, honestly, some of those things are probably really good things that can only be good for all of us, guests and crew alike. So thanks for sticking with me throughout this. Again, be sure to subscribe, click the bell to get notified when we post new videos, and give the video a thumbs up if you liked it. If you didn't like it, click the thumbs up button twice. Follow us on social media. Check out the links below to see other relevant content on CruiseHabit.com, including our message boards where you can ask me and other cruisers about all things cruising, or we can just hang out, relax, and look forward to the next sailing. So we look forward to talking ship with you again, and maybe even seeing you at sea real soon. I'm Bill from CruiseHabit.com, and this is Quarantine Hair. Goodbye, beach.
What?
Say goodbye to the beach, Larissa.
Goodbye, beach.